Hello and welcome to our video on OET speaking tips and strategies. This is Mr. George Matthew from Darsana IELTS OET Academy Kottayam, and in this video, we'll be discussing some practical tips and strategies to help you improve your OET speaking performance. The OET speaking test is an important part of the OET exam, and doing well on this section can make a big difference to your overall score. So, let's get started. Section 1. Understanding the OET speaking test. First, let's talk about what the OET speaking test involves. The test is divided into two parts, the role play and the discussion phase. In the role play, you'll be asked to take on the role of a healthcare professional and interact with the patient. In the discussion phase, you'll have a conversation with the interlocutor, the person conducting the test, about a healthcare-related topic. The test is designed to assess your ability to communicate effectively in a healthcare setting. To achieve a high score in the OET speaking test, you need to show that you can communicate clearly and effectively, use appropriate medical terminology, and demonstrate empathy and rapport with the patient. Section 2. Tips for pronunciation and intonation. Pronunciation and intonation are important aspects of OET speaking. Your ability to pronounce medical terms correctly and use stress and intonation to convey meaning can make a big difference to your score. To improve your pronunciation, try practicing individual sounds and listening to and imitating native speakers. Using stress and intonation correctly can also help convey meaning and show that you understand the patient's concerns. Let's take a look at an example. Instead of saying, "I think he has an injury to his hand," try saying, "I think he has an injury to his hand." This small change can make a big difference in how you are perceived by the interlocutor. Section 3. Strategies for answering questions. In the OET speaking test, you'll be asked a variety of questions, including open-ended questions, yes, no questions, and hypothetical questions. To answer these questions effectively, it's important to have a clear structure in mind. One helpful structure is the SPEAK formula, which stands for situation, problem, evaluation, action, and knowledge. Using this formula can help you provide a clear and concise answer that addresses all aspects of the question. It's also important to avoid common mistakes, such as giving irrelevant information or not providing enough detail. Make sure to listen carefully to the question and provide a relevant and detailed response. Section 4. Tips for active listening and interacting with the patient. In addition to answering questions effectively, it's important to demonstrate active listening and empathy with the patient. This can help build rapport and show that you understand the patient's concerns. Some tips for active listening include asking clarifying questions, summarizing the patient's concerns, and using appropriate body language. It's also important to show empathy and understanding, even if you don't agree with the patient's point of view. So, those are some tips and strategies for improving your OET speaking performance. Remember to practice your pronunciation and intonation, use clear structures when answering questions, and demonstrate active listening and empathy with the patient.